For decades, people from the Rakhine State in Myanmar have been displaced by violence. The largest influx into Bangladesh occurred in 2017, with more than 600,000 people arriving in southeastern Bangladesh between August and December 2017, adding to the 300,000 people previously arrived, heavily affecting an already vulnerable host population. As of 31st January 2024, 975,350 forcibly displaced Myanmar nationals have registered in Bangladesh, living in 33 extremely congested camps made of vulnerable bamboo and tarpaulin shelters in the Ukhia and Teknaf Upazila of the Cox's Bazar district, more than 50% of whom are boys and girls below the age of 18. People continue to face instability, health risk, poverty, and natural and climate hazards, resulting in the continued need for humanitarian assistance. Here is how a unique partnership modality established by the Bangladesh Red Crescent Society and supported by the Swiss Red Cross has helped address some of the most pressing health needs of the displaced population. Following the large-scale displacement starting on 25th August 2017, the government of Bangladesh called on the Bangladesh Red Crescent Society to respond to the emergency in line with the National Society's mandate to provide humanitarian aid as auxiliary to the public authorities. The Population Movement Operation was established under the shared leadership of the Bangladesh Red Crescent Society and the International Federation of Red Cross and Red Crescent Societies, and supported by over 30 partner national societies, including the Swiss Red Cross.
The Swiss Red Cross has been present in Bangladesh since 1972, supporting its partner, the Bangladesh Red Crescent Society, in various areas of intervention across the entire country, as well as in emergency and disaster response. This long-term presence really allowed us to immediately support the humanitarian response to the influx of people from Myanmar in 2017 by deploying different delegates in the areas of health, as well as support for shelter constructions and logistics. The public health system in Cox's Bazar was overwhelmed by the amount of people needing care, so the government of Bangladesh decided to establish at least one primary healthcare center per camp. To this plan, the BDRCS contributed with support of the Swiss Red Cross and in collaboration with the Ministry of Health by establishing 3 primary healthcare facilities between January and June 2018. Later on, and based on persistent needs, 2 additional primary healthcare centers were established, one in 2020 and an additional one in 2022.
Bangladesh Red Crescent Society সরকারের ডাইরেক্টর জেনারেল হেলথ সার্ভিসেস সাথে পার্টনারশিপের মাধ্যমে সুইস রেড ক্রসের সহায়তায় প্রাইমারি হেলথ কেয়ার সেন্টার স্থাপন করেছে। এই সেবাটি একটি যৌথ মডেলে জয়েন্ট কোলাবোরেশনে হওয়াতে এর একটি বিশেষ ভ্যালু অ্যাডিশন রয়েছে। সরকারের সাথে যেহেতু আমাদের অ্যাক্সেস রয়েছে, এই জন্য আমরা ইনফ্লাক্সের শুরুতেই এই প্রাইমারি হেলথ কেয়ার স্থাপনের জন্য আমরা জায়গার ব্যবস্থা করতে পেরেছি এবং সেবাটি খুব দ্রুত চালু করতে পেরেছি।
The services that are provided in this primary healthcare facility, they range from general consultation and emergency care to essential services for mothers and children, including normal deliveries, newborn care, as well as nutrition counseling and screening and family planning. The services also include support related to protection, including psychosocial support, as well as counseling and case management of survivors of gender-based violence, as well as restoring family links. And the whole service package is supported by community-based health and first aid. So by joining forces, BDRCS, supported of Red Cross, Red Crescent, societies, and in partnership with UN organizations and NGOs, are providing essential and life-saving healthcare services as well as protection assistance to people in need, all from under the roof of one facility and provided free of cost.
Our contribution, of course, it was to the government plan, but it was unique in the sense that the government was also struggling to find a solution in terms of setting up a physical structure that was semi-permanent and yet appropriate enough to deliver services with dignity to the people in need. And that is where BDRCS and Swiss Red Cross came up with an appropriate solution, which government liked. And that eventually, setting up this kind of a physical infrastructure became the standard, a model that was widely promoted and encouraged by the government.
These primary healthcare centers have become lifelines for the displaced population and neighboring host communities, especially for women and children who make up the majority of health facility visitors.
आरा कम्युनिटी वॉलंटियर आरा कम्युनिटी जायरे तारारे आरार हॉस्पिटलर बाबूते सेবার बाबूते तारारे अवेयरनेस करी अवेयरनेसर पाशापाशि तारार सुविधा असुविधा यानो জানিয়রে তারারা আরা হইরে হসপিটালত পাঠাইরে তারা সেবা যখন বেগিন একান্ত পাই ফেলে হসপিটালের প্রতি একাম বিশ্বাস জন্মাই আসসালামু আলাইকুম ওয়া আলাইকুম আসসালাম আসসালামু আলাইকুম ভালো আছি ana ভালো আছো না আলহামদুলিল্লাহ ভালো আছি আর তো আগলতে হামিল আইরা আগে দুবার শেষা করতে আসছিলাম ভলান্টিয়ারে আগলতে আরারে ফসারে সাতটাং হানা হাইতয়ে দুইবার গুণ যাইতে হয়ে ইয়া শেষা করতে আসছি রে
আর ক্যাম্পের ভিতরে মেডিকেল আনছে তো আছে তাহলে আর যখনের মধ্যে আর কি ভাই সিরিজটা পাই তাহলে আর রাতে নিশ্চিত আইলেও ভাই দিনত বেলা আইলেও ভাই যখন টাইমে আর ডাক্তার দেখা করে বালা ভাই তাহলে আর তুমি বাইরে মেকে যাওয়ানোর কি নাই
আই ডাক্তার দেখাইতে আসি দে বাচ্চারে সিরিজটা করতে আসি ডাক্তার দেখাই আর বাচ্চার অসুস্থ দে তাল্লা ডাক্তার দেখাই আর ওষুধ লই আর বাড়ির মাঝে গরম মাঝে চলে দাঁড়িয়ে
যেহেতু অনেকগুলো অর্গানাইজেশন একসাথে কাজ করি আমাদের মধ্যে একটা কম্পেনিয়নশিপ আছে ট্রাস্ট আছে বিশ্বস্ততা আছে এই কারণে আমরা একসাথে সবগুলো চ্যালেঞ্জ সবাই ইউনিটি হয়ে ফেস করতে পারছি ওভারকাম করতে পারছি
Over the years, the primary healthcare facilities and partnership have undergone several changes, primarily influenced by funding constraints. Throughout the program phases since 2018, the partnership approach was essential in addressing emergent challenges and bridging service gaps.
So it was not technically possible to support from government side to set an individual HR to monitor throughout the camp. So in terms of that, BDRCS has supported a lot to the government and through PSC steering committee meeting by the BDRCS and IFRC and the government, we discussed, we gave our suggestions, we hear their expectations and limitations, we took their feedback and gave our suggestions, we settled it down by the regular discussions and the meeting.
Coordination of all those partners is not always as easy as it seems because every partner has a different objective and different packages to bring to the table. The advantages that we find in working with BDRCS is that it brings on board many partners from different areas of expertise and provide a holistic package to the beneficiaries.
We are collaborating with Swiss Red Cross and Bangladesh Red Crescent Society in 2 camps in 2 primary healthcare centers in Camp 2 East and Camp 6. We are bringing resources from both organizations and in fact it brings or alleviating pressure among the partners who are working in this partnership to ensure the seamless operation within this primary healthcare center.
Partners were also facing financing challenges and had to either scale down or withdraw services altogether, in which case we have had several instances where BDRCS has taken over direct service provision or existing partnerships were expanded.
Overall, these primary healthcare centers have significantly contributed to improving the health status of the displaced community. More than 6 years after the large-scale displacement of people from Myanmar to Bangladesh, there is no sign of a durable solution. The conditions for safe and dignified repatriation are currently not conducive, leaving almost 1 million people dependent on humanitarian aid indefinitely. The persistent needs continue to exceed the resources and capacities of the government, while the focus of the international community, media, and donors has shifted to more recent crises. The Swiss Red Cross will continue supporting the Bangladesh Red Crescent Society in operating health facilities with the potential of BDRCS successively taking over more services in case partners have to withdraw because of shortages of funding.
বাংলাদেশ রেড ক্রিসেন্ট সোসাইটি বিভিন্ন সেবামূলক কার্যক্রম পরিচালনা করে ক্যাম্প সমূহে। তার মধ্যে অন্যতম কার্যক্রম হচ্ছে প্রাথমিক স্বাস্থ্যসেবা প্রদান করা, এবং তারা যেহেতু পুরো মাত্রাই হিউম্যানিটেরিয়ান সার্ভিসের উপর ডিপেন্ড করে, এবং সেই জন্য তাদেরকে এই সহযোগিতা অব্যাহত রাখতে হবে, এবং আমাদের এখান থেকে ফিরে আসার কোনো সুযোগ নেই। সেক্ষেত্রে সুইস আমাদের একটা গুরুত্বপূর্ণ পার্টনার, এবং তাদের সহযোগিতার এবং বিশেষ করে দীর্ঘমেয়াদী পার্টনারশিপ আমাদের প্রয়োজন, এবং সেই লক্ষ্যে আমরা একসঙ্গে কাজ করছি।